I am just having Dr. Samji join us. Hello, Dr. Samji.
Good morning. Can you hear me okay?
I can hear you perfectly. Thank you for joining us.
Oh, thank you for having me.
So we have a few people that have already joined us. A few of our CANFAR friends joining us for our first 2021 virtual talk at CANFAR on this amazing day for Bell Let's Talk. So I think without further ado, I will start. So again, I'm Alex, of course. I'm with CANFAR, and we're introducing today Dr. Samji, who will be joining us for a brief talk today to address some of the research that you've been doing recently. So let's start and tell us a little bit about how you decided to do this type of research and in this particular field.
Thank you, Alex. And again, such a pleasure to be here with you. And I just want to start by thanking CANFAR and all of the donors and funders for the generosity of your funding of this work. And again, how apt it is that we're talking about mental health among people living with HIV and hepatitis C on Bell Let's Talk Day. So that's really wonderful. And thank you for that invitation today. I'll also give a little shout out to my co-investigators on the project. So Naveed Janjua here in British Columbia, Travis Salway, and Naomi Dove are my awesome collaborators in this work. In terms of, what brought me to this work, I started volunteering in the realm of HIV back in 2005 on Vancouver's downtown east side. And I have to say, I learned a lot of important lessons about health equity and people's journeys and heard a lot of unaddressed trauma, essentially, that many of the folks that I was working with there had difficult life experiences and adversity. And that's what prompted me to want to look a little more closely at mental health among people living with HIV and hepatitis C.
Yes, it's very important work, obviously, and we're so proud that of the work that you are doing and that you will be doing and helping, obviously, our communities. What about this particular project in particular that was a defining moment for you in terms of starting the research?
Thanks, Alex. So, I had looked at life expectancy among people living with HIV in North America and saw that we kind of made tremendous gains in that regard. And yet, the next thing really is to think about quality of life. And I always quote this one woman living with HIV who said, HIV is no longer a death sentence at the advent of triple therapy. She says, but it's a life sentence. You have to live with it for life at the moment. And hopefully that will change with CANFAR's work and others. But for the moment, it's something to consider over the long term. And so how can we improve people's quality of life? And mental well-being, I think, is a big part of that. They say there is no health without mental health. And so it's a part of the picture that I think we need to look at a little more closely.
That is so true. And people do forget that although the quality of life that we can expect today is amazing, but there's no cure, and it's something that we that we live with all our lives. So it is that definitely impacts the way we see ourselves and the way we see others and the way we function in the surroundings that we are. So what are some of the outcomes of this research that you would like to see in the short term?
Well, I hope that we can show that in the Canadian context, mental illness is affecting the larger population, and also that there is an increased burden among people living with HIV. So the first step is really to show the epidemiology, and we're really lucky in the sense that we're working with these incredible population-level data sets that aren't really clinical samples, which are also important, of course, but they can lead to some bias, so they can be specific populations, whereas these population-level data sets that we're working with really give us a glimpse into the whole population of people living with HIV in British Columbia. And so the epidemiology, so understanding the burden, so in the short term, learning about, how many people actually are living with mental illness who also have HIV, and which mental illnesses, because of course mental illness is not a monolithic whole. There are different illnesses among that, and then we can look at the severity as well. And our team previously has developed algorithms to look at how can we measure mental illness in these big data sets. So we'll be using that work to inform this work.
And so the data that you'll have and some of the tools that you can develop around that, how do you see that really in helping people that are living with some mental illness or some challenges there and their HIV status, or more vulnerable to become HIV as well?
Yes, absolutely. So I think part of the picture is once we're able to kind of create this evidence, right, that there is an increased burden, and sort of looking at it more closely, which particular mental illnesses, the next step then is, to starting this conversation is, well, what next, right? How can we actually go and improve people's lives who are living with both HIV and severe and persistent mental illness? And so part of this work is to get that conversation started. And then one a very specific idea in this realm is called diagnostic overshadowing. So it's this idea where if you have, say, HIV, so this kind of diagnosis that is pretty comprehensive and needs a lot of attention, other things might get ignored. So if we can demonstrate that there actually is an increased burden of mental illness among people living with HIV and hepatitis, then clinicians and other folks who work with people living with HIV, service organizations, can then actually look for mental illness, perhaps, and not just mental illness, but think about what we can do to improve mental well-being and mental health promotion, as well as is a really important part of the picture as well.
And decisions around care and how to improve care as well, and access to care. Do you feel, or do you have an opinion on how COVID-19 and this whole pandemic, I'm sure you've been asked this a lot, and it's a question that's in front of mind for all of us, how this pandemic is impacting populations in general with mental illness, but also in particular populations that are more at risk of HIV or living with HIV. Do you see a greater impact or bigger consequences?
That's really the question on everyone's mind right now. And one of my other projects is looking at mental illness in the context of the COVID pandemic at a population level, not just among certain populations, but really at a population level through some surveys I'm working on. And we've collected sort of the first wave of data, and we're already seeing that there are tremendous impacts. They're calling it a tsunami of mental illness that can be expected post-pandemic, but in fact, we're already seeing it during the pandemic. And so I think among people living with HIV, that is going to be the same or potentially worse, and we don't know, right? This is something we need to measure as time goes on, but it's certainly something that clinicians and service providers and others should be keeping an eye out for, knowing that mental illness is affecting all of us going through this pandemic.
Well, you've got the pandemic that's happening now, and that has, like you just said, some lingering effects, and we don't know how long these effects will be in place. And when we look at CANFAR2025, which is our platform to end the HIV epidemic in Canada, I wonder when you look at the work that you're doing and some of the outcomes that you see, how it can help the general population to lower new infections through, I guess, better understanding, better awareness, and feeling better about oneself through wellness, like you said, and decision making. How is that factoring into your work when you see the impact that you could have?
Yeah, absolutely. So I think, you've hit the nail on the head, which is that there is actually a lot that we can do to improve our mental well-being. So just as our physical fitness doesn't just happen automatically, I wish it did, but that's certainly not the case. And similarly, I think there's a lot of misconceptions about happiness and well-being, and that you either have it or you don't, it's automatic or it's not, but that's really not the case. It's something that you can work on. And so one of the things about the COVID pandemic that everyone is suffering through is social isolation. And we also know that even in general, outside of pandemic settings, social connection is one of the things that can increase our mental well-being the most. And so I think that's an area that where we can really pay a lot of attention for our own mental well-being, and thinking about how we can connect with others. I'll give a little shout out to a really concrete sort of area that people can look at. So Lori Santos is a professor at Yale, and she runs a course on Coursera, so it's free, and it's called The Science and Practice of Happiness and Wellbeing. And you can access that. She has a podcast, so there's really what I really like about it is it's not only self-help. It's not just saying you should do this for your mental well-being, but it's actually saying, well, this is the scientific evidence behind each of the things I'm recommending. And as an epidemiologist who likes data, this is something that I appreciate, and I think others would too. Really concrete kind of steps you can take to improve your mental well-being in the context of the pandemic and beyond, hopefully, as well.
I know this is maybe a question that's a bit vague. I'm not sure how you can answer this, but when you get to the end of your work, how do you see all that incredible data that you're getting and recommendations? How do you see that reaching all the various populations? How do you get from the result that you've been able to acquire and put that into practice?
Yeah, that's great. A great question. And I think some of what we're talking about today and whoever's on the call, like these are great opportunities to reach folks who are also interested in this work. So this work is happening in British Columbia. But I think the next step in my mind is to make connections with folks across the country, both service providers, people with lived and living experience, and make those connections with people who are also interested in this area. And I know CANFAR will be a great venue for making those connections. Yeah. And certainly within British Columbia, our existing relationships with service providers and community groups working in these areas will be instrumental in helping us translate the knowledge that we've collected and influencing practice decision-making.
Well, this is amazing. I mean, I'm always very impressed with the level of commitment that yourself and other researchers across the country have, and really finding solution and finding ways to really help and move the dial. And as I said earlier, our CANFAR 2025 campaign is all about moving that dial and working collaboratively across the country and with research like yourself to really create a space where solutions can be found and really concretely help everyone that needs the help and give it access to care and make it easier. I'm really impressed, like I say, about the work, and I don't know if you could summarize a little bit our conversation today in your words of saying, well, you know, this is the impact that we think that we can have and actually achieve in the next year or so.
Yes, thank you. So really the goal of the work is to describe the burden and then to think about next steps. So when we understand kind of what the impact of mental illness is having on people living with HIV and also for risk of getting HIV, then we can take concrete steps to think about how we can change those trajectories, right? So people living with HIV, reducing the mental illness burden, and then also for those who do have mental illness, how we can make sure we're treating both HIV and mental illness together and improving quality of life for people living with those conditions.
Thank you so much. I really appreciate your time today. I appreciate you, how passionate you are now and sharing all of this with us. And it's very encouraging to see young talent like yourself really making a change. And especially on a day like today, gives us much to reflect on. Thank you for joining us. This was a really good first CANFAR virtual talk. I'm not sure if there are questions that came up that we can address, but as this is my first time, I'm not great at seeing or maneuvering. So I'll take for granted that if anybody really wants more information about this, they'll reach out to myself, and I can make sure to reach out to you as well and make sure that we answer any questions. I really look forward to seeing the results of your amazing research and staying in touch and really learning, absolutely opening our minds and learning on how we can do better and create greater access to care. Thank you so much, Dr. Samji.
Thank you, Alex, and thank you, CANFAR. I appreciate it. Bye, everyone.
Have a good day.
Take care.
Cheers.
Bye.